That hospice, it seems really scary because it's the last part of your life, but it can be a wonderful experience.
We certainly can take care of people in their last hours or minutes of living right before they die, but the types of relationships that develop over months, as in Andy's case and his family, provide a richer and I believe more meaningful experience at end of life for individuals. We draw from the expertise of multiple healthcare professionals.
I do Andy's personal care, bathing, that sort of thing.
I help coordinate care for Andy, like with his other providers.
I am his nurse. I go visit him 3 times a week on the average. I check in with him 5 days a week.
And my official title is spiritual counselor with BAYADA Hospice.
I coordinate the hospice volunteers that visit him.
I'm a physician. I'm the medical director for BAYADA Hospice in Vermont and New Hampshire. What is hospice? In the United States, hospice is defined by Medicare in terms of being a benefit for Medicare beneficiaries who have a terminal illness. The amount of joy that I feel in what we bring to dying patients' lives in their home on a daily basis makes those times of sadness very much in context of what we've given to their lives. Hospice is work with living people. And again, we have the privilege of getting to know them and get attached to them sometimes.
I have learned from Andy a fair bit about understanding the impact that his life can have. He has given a lot of thought to lessons he wants to impart to his loved ones particularly, and I've learned a lot about finding joy in the midst of a really hard situation.
Andy doesn't say anything negative. He's just a really sweet person. And I've learned that you don't have to be negative. You can, be positive, and even in his extreme situation, he can find positive things and always look on the bright side.
They're the sweetest family in the world. And everybody's very helpful, and we just let Andy call the shots as to what he can do, and then we just assist and make sure it's done safely.
You just want to have my phone, don't you?
I think one of the things that Andy has helped me learn is the importance as a physician of empowering patient choice. And I've also learned a lot about what it's like to have ALS within a family that's affected by it on a large scale to a great degree of severity, and I'll never forget that. People may think that a hospice medical director does one thing, assign terminal illness and come up with morphine doses at end of life. That's a very narrow definition of my expertise as a hospice and palliative medicine physician, and unfortunately can be a barrier to engaging expertise around end of life.
People hear the word social worker and they think, oh, like they're going to do psychology on me, or they're going to want to talk about my family history or something.
Volunteers are really the eyes and ears often of the team and can notice and observe things, be aware of things just by virtue of how much time they spend with a client. They don't have any clinical training or background. They're really representatives of the community.
Spiritual care is really about addressing the big picture questions of end of life and acknowledging fears and emotions. And
I think people are, because they haven't done this before, are really afraid and think that they can't do this. And I think once they realize that they have the whole team supporting them, that it's easier to keep someone at home and take care of them and have their loved one with them.
Each condition that's a terminal condition brings its own particular challenges.
Because you never know what we did yesterday may not be anywhere near where we are today. So, and then maybe what you did yesterday was a bad day and today's a good day. So it's really more the where are we at today type.
One has to talk about things while person with ALS still has a voice. And if it comes to the point where those discussions had to be had when they don't have a voice, then questioning has to be simple enough for them to be able to respond in a yes-no fashion by using their eyes, by squeezing your hand. Does your team deal with the frequent occurrence of the death of your patients? The answer to that question is a highly individualized matter. It's highly personal as well as professional in terms of what our own selves feel at the time of a person's death. And also, I think it's important to remember when that question comes at us, the greatest time of sadness might come while the person's still alive. The greatest time of sadness might come 5 years later when you drive by their road and remember them.
You know, he's so brave. I call him my hero because he is. He's the only person in my life that I can say he's my true hero, because he's facing this disease and he's so brave. He's amazing. He's got so much strength, and he teaches me something every day that I go there. I learn something new from him. I could write it down. I can't remember offhand, but it's just amazing. Just the strength that man has.
I'll have to